Every year, about 1.7 billion cases of diarrhea are reported among children under 5 years of age. Unfortunately, 8% of this end in death. However, with best sanitation and hygiene practices, such diseases can be done away with. My name is Saada Hassan, and this week on Health Digest, we take a look at Siaya County and their efforts in achieving open defecation-free status. Siaya County, located in Lake Victoria Basin, it sits on an area covering 2,529.8 square kilometers. The county hosts a population of 993,183 people. It is grouped among counties with moderate open defecation rates within 6% of households. This translates to 59,464 homes still practicing open defecation as of 2019. Among Siaya's vast sub-counties, 2,245 villages equivalent to 100% were declared open defecation-free in 2018. The county recorded 92% latrine uptake in the same year. As a result, it embarked on post-open defecation-free activities to sustain the status and improve the latrines as well as households' basic sanitation. In Baragulu village, Alego, Songa sub-county, we meet this group of 15 community health volunteers and some members of the community. This is just but one of their weekly sessions. They meet to educate the community about best hygiene practices and encourage them to use SATO products. But what exactly inspired the need of having these groups?
Hakukuwa na maelewano sana kati ya health volunteers na ya kwamba kuna labda mingi ambao kwa community hayakuwa, kuna magonjwa yalikuwa yako lakini hawapeleki hospitali. Labda kama kuna outbreak, hakuna venye wananchi wanaelezwa ya kwamba waende hospitali ama hiki kitafanywa namna gani. And also hizo the outbreaks ndio ilikuwa inafanya wakose chini iharibike sana.
Open defecation has particularly devastating effects on the health of children under the age of 5. The situation can be grave in rural areas where the practice is more rampant. In Kenya, over 6,600 children under 5 are estimated to die each year from diarrhea, of which 80% are attributable to poor water, sanitation, and hygiene. This community understands too well the impact of non-communicable diseases and their choice to become champions of good sanitation practices.
Wakati SATO zilikuwa introduced na mambo ya SATO ikatuingilia hapa. Bahati nzuri tukaelezwa mambo ya hizi SATO products. Saa tuliangazia, tulikaa chini na tukasema ya kwamba kama sisi kule mtaani tunashughulika na mambo ya usafi. Choo at least tumejaribu sana, choo zimejengwa mingi. But usafi hayako sawa. Labda watu wanaosha mikono lakini baadaye choo unapata harufu ni mingi. Sasa tulielezwa na wale ambao walikuwa wametuletea mambo ya SATO products ya kwamba choo kama hiki ni nzuri mkiweka hiyo harufu hakutakuwa. Kwanza hii harufu ndio ilikuwa mbaya sana kulingana na vile huwa tunatembea kule mtani. Tukasema kama inaweza poteza harufu isipatikane sana, wacha tu tujaribu.
As the pandemic was ravaging many sectors of the country, their group was lucky to get funding from UNICEF. Together, their sole mission was to set up better toilet facilities that emitted little to no odor. Wilson says the change was not a challenge.
Kubadilisha mtu kutoka kwenye ile anajua, unamweka kwa nyingine upya. Upande wetu haikuwa ni shida sana. Haikuwa ni shida sana manake wengi ni wale ambao labda mtu anatamani awe tu na ile ya choo aina ya ceramic ile, lakini tayari ameona mwingine pia kumbe anaweza kuwa choo ambao inafanana tu na ile. Sasa na si expensive kama zile za ceramic.
The community health volunteers hold barazas once in a while to reach more members of the community. They also carry out visits and educate the residents about SATO products while explaining the advantages of each. They are subdivided across the villages, with the biggest group covering 68 villages.
Kwanza tulisema ya kwamba sisi mwanzo ndio tuwe role models. Manake huwezi kuuzia mtu kitu na utakuwa naye muda mrefu, wewe huna na unamuelezea nunue. Sasa tulisema ya kwamba sisi mwanzo katika hiyo ni nini, sisi hiyo grant sisi ndio tulikuwa customers wa kwanza, tukanunua na tuka install makwetu. Hakuna mtu hana nini, at least mpaka kama huna stall uko na pan. Saa zingine mtu anaweza amua zake ziwe pan zote. Lakini sasa ile uzuri ya product kama SATO stall mtu atajionea sasa mwenyewe. Kwa community hatuwapati chochote, but ni kuwaelezea uzuri ya SATO, ambapo akiinstoliwa itakuwa hivi. Manake ni marketing. Tunafanya marketing.
Caroline Auma, the head of marketing and the Baragulu Secretariat Committee, explains how the SATO products work.
Ni safi sana ukitumia, ni rahisi kuosha, tena watoto wanatumia kwa urahisi, watoto wadogo wenye wanajifundisha kuendea wanaenda kwa urahisi.
She says the toilets are also efficient for those having difficulties with their knees or sitting down.
Na hizi juu zimeundwa kwa hali ya juu, utapata iko na kifuniko, inazuia hakuna inzi yoyote inaweza ingia ndani ama mende. Na hii tunaita SATO pan, ni ya chini, unaweza iona venye unaiona hivi, inaitwa SATO pan. Inafunguka kwa urahisi. Tuko na SATO flex, unaweza iona hivi. Hii iko na ujuzi yake, iko maridadi, tena ni safi. Unaona pia inafunguka na inajifunua na kufunguka na kujifunika kwa urahisi. Tuko na SATO stool. Hii sana sana ndio inasaidia kwa magoti. Ukiwa na maumivu kwa magoti ama ukiwa na shida kuinama, utakuta ni rahisi. Unakalia tu, tena unaenda haja yako kwa urahisi. Na zote ni safi sana.
The products can fit any type of toilet and they are affordable. So far, they have sold 158 SATO pans to the community. Weekly, the committee meets to review their progress and educate the new members while making new proposals. A SATO stool is sold at 1,200 shillings, while a SATO pan goes for 600 shillings. A flex pan, on the other hand, is sold at 950 shillings. The buyer parts with 200 shillings as installation fee. Despite their relatively manageable cost, at times not everyone can afford the cost.
It is quite challenging, but ni kuongea tu na unajua si watu wote watakubaliana na wewe, but ukienda mwingine pia anasema sasa kama kitu ya kula ndio hakuna, sasa ninunue choo, vitu kama hizo. Those are the challenges ambao tunapata kutoka kwa community members. But ile kurudia mpaka labda jirani anapata jirani yako nayo, na yeye pia akitembelea jirani ifike wakati anataka kwenda choo anaionea pale. Kile ambao inawavutia hata wale ambao tayari washanunua na wameinstall, pia wanaelezea watu hiyo choo ni mzuri, ukiwa nayo hakuna harufu. Unajua hiyo mambo ya harufu namba moja. Sasa watu wanaanza sasa kufikiria kwamba hata mimi pia nataka choo kama ya fulani, ile choo kama ya fulani.
UNICEF and the government have successfully established community-led total sanitation programs, or CLTS, as a strategy to help end open defecation in the county. Community-led total sanitation programs focus on behavior change to ensure that people in communities are held responsible for building and using latrines. George Ogo is the county public health officer in Siaya. He says the county is on the right track.
The journey started in 2010. In 2010, we were at around 65% latrine coverage. But with efforts which were made by our WASH partners, among them UNICEF. UNICEF played a key role. We also had SANA International. We also had Plan International, among others. They helped us to take communities through the process of TLTS, which entailed triggering the communities. When we triggered them, when we triggered the communities, they were getting to know their sanitation challenges. After triggering, then the community were drawing what we call, they were drawing some maps, and in the maps they were to identify the areas where the community go shit. Then they make plans in the process, and by making those plans, they agree that families without toilet facilities were to put them up within what time period. Siaya County was declared open defecation-free in April 2018, and we have strived to maintain the status from then to date. This has been done courtesy of partners again, and even the county government, where we have been implementing the so-called market-based sanitation. In market-based sanitation, we were trying to maintain the status quo, to sustain the gains that we had achieved when we were declared open defecation-free. So in market-based sanitation, we are upgrading toilets or latrine facilities which are in existence with SATO products so that our communities go up the sanitation ladder. We are also putting up affordable sanitation facilities which our communities copy and replicate in their homesteads or households for that matter.
Kenya is among the 26 countries globally responsible for 90% of the world's open defecation. According to the 2019 Kenya Population and Housing Census, almost 85% of this open defecation in Kenya takes place in 15 counties. According to the monitoring tool, all villages in Siaya County are certified open defecation-free. However, recent reports show that the county has substantially made huge strides backwards as far as old open defecation practices are concerned.
The products that we bring, that we market to the households, quite a number of the households believe these products are brought for free, and they expect that we give them for nothing, so that they can use them to upgrade their toilet facilities. Maybe another challenge is the poverty status in some of our households. There are households which may not put up toilet facilities. So they are the ones who share toilet facilities with the neighbors. Now, homesteads, we expect actually 100% latrine coverage, which is not very possible. Currently, we are at 92% latrine coverage as a county. That means maybe those who are not able to do their latrine facilities make us not to achieve the 100%. Another challenge is that there are areas of Siaya County which experience flooding. the areas around Usonga, around Rwambwa, the areas around West Imbo. When rains come, their toilet facilities collapse, and that brings down the latrine coverage that we have so far achieved.
According to UNICEF, exposed fecal matter contaminates food, water, and the environment and can spread serious diseases. Open defecation can also undermine individual dignity and safety, especially for girls and women.
When communities don't have toilets, it means that they are defecating in the open. And that is also an issue that becomes a safety issue, because when that waste finds itself into water and food systems, it can also be a source of disease. Diseases like cholera come out of fecal matter, interacting with food and also interacting with water sources. So sanitation and being open, having villages in these counties and in our country open defecation free also means better health for people.
In another village, we meet James Odongo Odhiambo. He is a survivor of the 2007 to 2008 post-election violence. He suffered serious injuries that left him disabled. Using the toilet was a hard task for him due to his condition, but life is easy now following his decision to construct a sanitation block with a sato pan.
Nilikuwa na shida ya kwenda choo kabla hapo mbeleni kwa sababu siwezi squat. Lazima nitafute ilikuwa sasa choo, ilibidi sasa tujenge choo ya mawe, bricks, shimo ya bricks ambayo imekuwa raised ili niweza kukaa. Sasa ilikuwa shimo, tuseme size tu ya ikiti. Tuka raise, ikawa hivi sasa, ilikuwa sasa nikienda sasa nakalia tu. Sasa baada ya hapo ndio nilibahatika kupata choo fulani, choo kutoka kwa rafiki ndugu yangu, walikuwa nauza hizo vyoo. Sasa akaja akaniwekea choo, nikajenga choo ingine. Baada ya kujenga choo ingine, akaja akaniwekea. Sasa niko na choo yangu ambaye iko raised, naweza tu kukalia bila shida.
Necessity being the mother of invention, he is living the beauty of science and its quest to make life easier at an affordable cost.
Mlemavu huwa Mungu anampatia akili fulani. Ningeweza sasa, najua saa zingine unaweza enda nje usijisikie unataka enda choo huko nje. Hata unaenda mahali hakuna choo yako ya kukalia. Sasa mimi naingia tu mahali hata kwa choo. Si ndio sasa choo. Mimi naenda tu nakaa hivi. Si nikikaa hivi sasa nimekaa. Mimi naenda tu choo. Kwa shida naenda tu choo. Like shida. Sasa hiyo ni nyingine ambayo Mungu huwa anapatia mlemavu. Kitu ambayo hujui.
It is quite evident in Siaya County that with the introduction of this program, the last outbreak of cholera that we had was in 2017 during election time. That is when the public health teams, the health teams rather, went out to try to bring down cases of cholera that were reported. But from August 2017 to date, we have not recorded any case of cholera. I think that is a pointer that the program is really working and it's doing the good to the people of Siaya.
World data shows that many countries are already off the rails towards ending open defecation by the year 2030. As a result, UNICEF has commitments to end this by implementing a strategy that reaches out to the 26 countries that account for over 90% of global open defecation.
I think a lot of it is about ownership. A lot of it is about ownership. We want to make sure that communities understand the importance of sanitation, the importance of hygiene at the household level. And I think over time, it's been proven that when people understand the importance of something like that, but also participate in its development and its sustainability, it ends up being much, much more effective and successful. And so we've moved away from construction, and now we are, building capacity, sharing information, sharing models, availing cheap products which communities can afford and get the skill to construct. We have artisans these days, who are able to, get the Satopan and install in their own homes, but also to make a living out of it. So our move away really is, I think, the next level of, the development process, where one understands the importance of something, but also takes ownership of being part of the solution by investing in that area. UNICEF can achieve very little of its work if we don't work through county government structures or even national government structures. And so community health volunteers are part of the health system in our counties, and they are located in every sub-county, and most of, in a county like Siaya, they have 100% CHV coverage. So these are county human resources, and so we work through that system to ensure that we send the message of hygiene and the importance of having open defecation eliminated through that system.
Schools are also not left behind, as children are great agents of change. Through hygiene clubs, the children are able to share the knowledge with their communities. Diseases that are as a result of open defecation are likely to cost the country up to 5% of its GDP. But with measures put in place by the national government, county government and supporting partners, this is likely to change in the near future. Saad Hassan, in Siaya County, KTN News.
KTN News.